This is Dr. Chestnut. I just want to explain the handout that you got about artificial joint fluid, period. So used to dictating, we put the period in there automatically. But I prepared these handouts and I love the chance to be able to explain them more. What does artificial joint fluid therapy do? And we know the artificial joint fluid injection gives long-lasting pain relief in about 80% of our patients. Period. It changes the thickness of the fluid in your knee. With arthritis, your knee fluid gets thinner. It's more like water. And this gets it back very close to normal. The artificial joint fluid therapy also has an anti-inflammatory effect that lasts for a long period of time. It seems to soak into the bone and relieve bone pain even after the injected medication has broken down. It lasts for months, sometimes even for years. We do much less surgery for mild to moderate knee arthritis now because this joint fluid is working well. The joint fluid is used when oral anti-inflammatory medications aren't working to give adequate enough pain relief, or you're having side effects from them. If you have stomach irritation, bleeding from the bowel, allergy to aspirin, you can't take NSAIDs. For some people, it causes a lot of fluid retention and swollen ankles. If you get swollen ankles, it doesn't mean you have heart failure. It just means you are taking ibuprofen or Aleve, uh, one of those, and we need to change the plan. Artificial joint fluid has none of these side effects. It lasts 6 to 24 months before it's repeated. The therapies become more popular as the low side effects and the good quality of pain relief becomes known. I mean, people just don't have pain. They will go through the entire day without noticing any problems with their knee. Period. I ask people if they can squat without any pain, and it varies. I have some people who can squat, and some people who still have discomfort in their knees if they sit on their heels. Um, but they just avoid that. The what is the stuff? It's sodium hyaluron's the name of the active agent, and it's manufactured two ways. One is extracted from the cartilage of the combs of roosters, and the second is it can be fermented by specific bacteria to produce it, genetically engineered bacteria. The known side effects of the medication are an allergic reaction and knee joint irritation. Oh, we've not had allergic reactions. It's very rare to have a knee joint irritation, maybe once a year. And if somebody's showing a tendency toward that, then we can mix steroid uh, with it and inject it at the same time. Now, most of these are 3 injections spread out over a month. There is one that has approval from the government to put all 3 shots in one big syringe, and it's very popular. Um, I'm told 75% of the Synvisc that's given is Synvisc 1, this one injection. I tried it for 6 months, and the results were just not as reliable. I had 5 failures, and using the 3 injections spread out over a month, it's just rare to have a failure. So I still use the Synvisc 1 for people who are out of town, people who are very frail or don't have transportation. And then if that's not working well, we'll supplement that with some cortisone. But one way or the other, we usually can get pain control. We cannot grow cartilage cells in the knee. We can grow cartilage cells, but if you put them on the end of a knee bone, they get scraped off. So we can't do that, but we can get the fluid that's in cartilage cells. A cartilage cell is 60% water or fluid, and that is the sodium hyaluron. So even though we can't grow cells and have them healthy in the knee, we can inject the fluid that's inside the cartilage cells. Now over here to the right is an example of the properties that are changed. If you look down here, it's molecular weight, that is how dense is it, elasticity, how bouncy, stretchy is it, and the viscosity, how slippery is it. And this talks about what healthy figures are, 45 And with OrthoVisc, you get 46, slipperiness of 46. And without this, the normal arthritic knee is only 1.4. So an arthritic knee is, 1/46 as slippery on the inside as a knee after it's been injected with, this is OrthoVisc, but it's the same with the others. The molecular weight, the density of it is 0.6 in the arthritic knee, and with these injections, they get up to more like 2.5, and normal is 3 to 4. So we don't get the molecular weight, but we're much better than what it was before. And the last is the elasticity. Normal elasticity is 117, and with osteoarthritis, it's nothing. And with these injections, it gets up to around 60. So we're able to get about half of the elasticity of your normal joint fluid. And then not shown in here is this anti-inflammatory effect that causes the pain relief for much longer than the fluid is in there. And that's not entirely understood. But fortunately, it works, and that's why we are now not having to do nearly as many arthroscopies in the early stages of arthritis. People do respond to this, and they get many years without a problem. Well, I hope this helps explain what I was trying to write here and how neat this material really is, and how fortunate we are to have it now.